we'll begin with Dr. Skinner. What is Rett syndrome, and what's the impact of the symptoms on those living with the condition?
So Rett syndrome is a rare condition. It's a genetic condition, a developmental condition. It predominantly impacts females, with about 1 in 10,000 females having Rett syndrome. Can rarely affect males as well. And it really is a developmental problem where the children will have normal development, meeting all their milestones for anywhere from 6 months to sometimes 3 years. And then their development seems to slow and then actually regress. And during that regression, they'll lose milestones they've previously gained, verbal milestones, hand use milestones, and motor skills such as walking may be lost during that time. Fortunately, that regression stabilizes, but unfortunately, all those skills don't come back. They certainly don't come back completely. So it's a lifelong condition with verbal communication problems, hand use, motor problems, but also other medical issues that develop, such as seizures, breathing problems, feeding problems, GI problems, skeletal problems such as scoliosis. So it has significant impact developmentally on children, and obviously that has a significant impact on families, but also medical impact as far as frequent hospitalizations, frequent medications, and just constant care that these children require.
Cassie, what prompted you to see a doctor for your daughters, and what challenges have you and your family, your daughters, of course, faced with Rett syndrome?
Well, Kenzie and Kaylee are identical twins. They're 10 years old now. For the first 6 to 9 months, they developed normally. But at around a year, we started noticing some differences. Kenzie stopped meeting some milestones. She wasn't trying to crawl. She wasn't trying to stand up and pull up like her sister Kaylee. In fact, we almost noticed Kenzie was starting to regress. She wasn't sitting as well. And so we became concerned. We went to many doctor appointments. Really didn't get any answers. We started therapy to try to help. But at 15 months is when we started seeing some more alarming symptoms. Kenzie started hand wringing, and so just almost constantly throughout the day, she was just wringing her hands right here below her mouth. She started teeth grinding consistently. She became inconsolable and crying day in and day out. And so I started doing some research on my own, and I came across Rett syndrome, and Kenzie seemed to meet all the criteria. So I made an appointment for her to be tested by a geneticist. And about a week later, we got those results that, yes, Kenzie did have the genetic markers for Rett syndrome. So since the girls are identical twins, that triggered testing for Kaylee as well. And at this time, the girls were about 2.5 years old. Kaylee was still meeting her milestones, was not showing signs of regression, but we had to test. And soon we received results that, yes, Kaylee also had those same genetic markers for Rett syndrome. And within the next 6 months, at about Kaylee's 3rd birthday, we saw the same thing: hand wringing, teeth grinding, inconsolable crying. Kaylee lost her ability to talk at that time. She lost her ability to have purposeful use of her hands. And that started our journey with identical twins with Rett syndrome. And so it's really a 24/7 challenge. They rely on us for everything. Kenzie never learned to walk or talk, so she's completely wheelchair bound. She has seizures. She has a feeding tube. She has respiratory issues that often lead to hospitalizations. Kaylee maintained her ability to walk, but she's nonverbal, so it leads to a lot of safety challenges. And so she just requires constant supervision. And so we see a lot of doctors for their complex medical needs, and it's really a complicated situation to manage.
Doctor, what can you tell us about the first treatment option approved by the FDA for Rett syndrome?
So this spring, the FDA approved the first and only medication specifically for treatment of Rett syndrome. It's called Daybue, D-A-Y-B-U-E, Daybue. It is an oral medication, and it was designed and shown to significantly improve some of the core symptoms or features of Rett syndrome, some of which Cassie just talked about. It helps slow down some of this hand wringing. It helps with attention, focus, responsiveness, alertness, helps some with some of the breathing abnormalities some of these patients have. So it's exciting. It's first time we've ever been able to provide families with something specifically to treat the symptoms and features of Rett syndrome. It's not a cure. It doesn't work the same in every individual. It has some side effects that are manageable, but it's exciting to have something now that we can actually offer to families for Rett syndrome.
And Cassie, this must be very exciting for you. How will it assist you and your daughters now?
So both girls are receiving treatment, and we've seen some really good progress with them. Both girls have calmer hands now, so they have less repetitive hand movements, which means we're starting to see more purposeful use with their hands. Kaylee's starting to turn pages of books and hold on to toys. Both girls are improving more in therapy during speech and during physical therapy. We're seeing more stamina, more energy, more vocalizations. Overall, we're just seeing more good days than bad, and so we are just really hopeful for just continued progress using this treatment.
Doctor, where can people go to get more information?
Certainly. There's a website, daybue.com, daybue.com, that provides information about this medication, indications, prescribing information, how to obtain it, side effects. It also has links to other sites to provide more information about Rett syndrome as well. So, daybue.com.
Thank you. Thank you both so much. I appreciate it. Bye-bye.